have to do that.
Last day of the conference, why not?
Yeah, right. I know. Ah.
We're good.
Yeah, you're
Okay.
perfect.
We just give you permission to tell us if we're in your way, as we spread out.
Everybody see that?
Will.
Essential ingredients. Does everybody have a handout? All right, welcome everybody. We'll wait till the 1 minute, right? Yeah.
I would give it a minute.
Yeah.
Two sheets,
No, this should, oh, yeah, one is, for today and the other, what's the other? It's my,
level pain control?
yeah, I don't wanna break the rule, but yeah, it's for something else.
Oh, okay, but
Yeah,
today it's the
it's a
essential.
one sheet, two-sided for today handout, which I think should also be in the, compilation they have.
For the download thing?
Download, yeah, because I sent that in to, Christy. I'm Bruce Eimer, well, I wanna wait. You wanna start? Can we start? Okay. Whenever you're ready to press the button, go.
We're going.
We're on? Okay, thanks. Oh, so, I'm Bruce Eimer, and welcome. And today, in 45 minutes, I'm gonna teach you the rudiments, the basics of a one-session stop smoking hypnosis session. One session stop smoking protocol. So, how many people here are practicing hypnotherapists and have people who come to you to get help with hypnosis to stop smoking? Raise your hands. Okay, and how many people have not yet seen somebody to stop smoking, but want to, okay? And how many of you that have seen clients to help them stop smoking with hypnosis have had a frustrating experience in getting them to stop? How many? Raise your hands. I'm one of them, okay? Okay, good. All right, so in today's lecture, what I'm gonna do is I'm gonna basically tell you what I've learned over a period of probably, what is it now, 25 years, of what seems to be most effective to help people stop smoking. And of course, not everybody is going to respond in one visit, but if they don't, well, you can see them again. And do we put on?
Yes, sir.
Okay, sir.
Hope that works comfortable.
All right, wait, oh, okay. I'm not good with this, so
I'll help you with it.
help me, please.
I will indeed.
I can't.
Help me, help me.
Help me, help me.
Right up.
Help me.
Want to drop that down and pull it up, or do you want to just put it there? We can do that too.
All right. I'm not very good with technology. Intimidates me.
Man's brilliant. He just doesn't.
Later on, he started talking
He's just not
about
mechanically inclined.
How handy I am. I'm your handyman, right? Yeah, right. I did change that fixture for you, right? Okay.
Let me get you a cue here too, as well as this
I
goes.
feel good about myself.
Listen to music by
That's a
itself.
good thing to do first thing in the morning.
No, not first thing
I
in the
hear a
morning.
certain song, I go to.
No way.
So,
Are
So
we
your
ready?
name and the topic you were speaking on, sir. This is Cypress C.
My name is Dr. Bruce Eimer, and today we're going to cover the essential ingredients of stop smoking in one visit.
Yeah.
So,
good
welcome
talk.
to you all. Okay, yes.
I want to fix your website. No at sign in your website.
Where's that?
Oh,
Where's that?
no, there's no at sign. There's
No,
no
that's
at
a-
sign.
that's an
W-
E.
My
Oh,
website
is
is
that an
W.
E?
Okay,
That
yes.
looks like an at sign to
No,
me.
no. Okay, I'm gonna leave questions to the end because we have a lot to cover. So we'll leave 10 minutes for questions. Right now I'm gonna start. The website is www.bruceeimer.com, as well as www.hypnotherapy.com. hypnosisce.com. So you can go there for more information about further training in how to do this, okay? There's also a sign up for an interest list on bruceeimer.com under professional training on the main homepage for those of you that want to follow up. Okay, so if you want to attract more clients to stop smoking, help them stop smoking, if you would like to help at least 70% of clients who come to you to stop smoking in one visit, if you would like to know how to follow up when they start smoking again, right after they leave your office, then you're in the right place. Raise your hand if you answer yes to any of these questions. Raise your hand. Don't be shy. Raise your hand. No? Okay. So you're in the right place. Excellent. So you're going to learn that here now. So, okay. Bottom line is you have to have a program. You have to have a structure. I'm going to share with you the structure that I use, and then I'm going to talk about hypnosis, and maybe, I don't know, maybe I'll give you a demonstration. Who knows? Depends on how fast I get through this. And that's why questions at the very end. I'll stay afterwards for questions. Anyway, the first thing is you got to screen your candidates for success. That's the phone call. 5 minutes, no longer. And you want to basically find out you don't want to, accept birthday presents. You got to speak to the person themselves. You don't make appointments for this kind of thing, for stop smoking or any kind of addictive behavior. You don't make an appointment with someone else who's making it for their husband or wife or something like that, birthday present gifts. No, it doesn't work. You have to speak to the person themselves, the client or patient, and that's important. You have to find out what is their motivator for wanting to stop smoking now, whatever it is, and then you tell them how you do it. What I do is I tell them the session lasts an hour, and I tell them that they have to bring all their cigarettes with them into my office. We get rid of them together. I tell them that I explain things to them. I educate them. I tell them things that they probably never thought about or heard before. And then I use a special method of hypnosis to fix the important suggestions and ideas in their subconscious mind so that they don't have to struggle anymore and they no longer have a craving. This is what they get in the first phone call. 5 minutes, no longer. The fee is $350. Okay? $350, and they have to pay it, no insurance, that's it. They can't do it, they don't want to do it, go somewhere else. Okay. Next. The first part of the session is 10 minutes. Interview. Find out their history. It's not like a boring thing, it's a motivational interview. You're trying to build their motivation as you ask them questions in the first 10 minutes. So basically, you want to do a very quick medical history. You want to find out what their medical situation is like, the medicines they're on, what their living situation is. You can do this really quickly. You want to find out how they found out about you. Naturally, I do that on the phone. You want to determine how much they smoke. What brand do you smoke? How many cigarettes do you smoke a day? What are your main triggers? Where do you smoke the most? A lot of people, they smoke everywhere. There's no main triggers, okay? It's in their head, it's a habit. And then you want to find out about their medications, how much they take. You want to find out about their use of stimulants, because nicotine is a stimulant. How much coffee do they drink? How much soda do they drink? You want to show that details matter. So you want to ask them, say like 3 cups a day. Well, are they cups? Are they mugs? Are they 16-ounce cups? Are they 12-ounce cups? Are they small ones? You go to Starbucks, that kind of thing, okay? You want to find out about their sugar use. You want to find out about any kind of recreational substance abuse, okay? So, nowadays we're talking about, a lot of marijuana use and anything else, and vaping, of course, the vaping business, that's a whole other thing. I'll just answer that as a question at the end. You want to find out about alcohol use, again, how much, what do they drink, and that kind of thing. And you want to find out, again, why are you here? What do you want to stop? Why do you want to stop smoking? What's your main motivator? What do you think the benefits are going to be if you don't smoke anymore? Okay? 10 minutes. It's very important to also to cite my good friend Roy Hunter. He calls it the benefits approach. You want to find out what the benefits to this client are to stop smoking. Okay, that's 10 minutes. 15 minutes you spend with giving them information, but you don't give them information in a dry format. It's in a way that they've never heard before, and I call it waking state reframing. Waking state reframing. So basically, the goal is to reframe the person's belief system regarding the dangers contained in cigarettes and other tobacco products, okay? And I go over the Surgeon General's warnings. Remember, I asked you to bring your cigarettes with you. So you bring a pack of cigarettes. There are 4 Surgeon General's warning in the United States. I think there still are. And, you know, any pack of cigarettes has one of those 4. I have I have many cigarettes in my office. I have many packs of cigarettes unopened in my office with the Surgeon General's warning. So somebody brings in a pack that says that, cigarette smoke contains carbon monoxide. That's one of the warnings. So now I get the 3 other packs that contain the other 3 warnings, and I stack them up, and I have theirs at the bottom. Remember that. Theirs are at the bottom. So now I start going through the warnings. So let's say they have, the warnings are carbon monoxide. The warning is carbon monoxide on their pack of cigarettes. So what I do is I stack theirs at the bottom, and now I go through the 4 Surgeon General's warnings. So we'll start with the first one on top, which in this case happens to be smoking by pregnant women may result in fetal injury, premature birth, and low birth weight. Now, oh, you're a guy. Well, you know, just listen to what this does to a pregnant woman. It can kill the fetus or cause complications that result in a miscarriage or some kind of abnormality upon birth. Now, you gotta know, sir, that the warnings that you're seeing on these packages of cigarettes, they're pretty dire, but yet they're compromises between what the government wanted and what the companies, the tobacco companies, were willing to give. So they're not telling you how bad it really is. But think about this. Smoking by pregnant women causes all these poisons in burning tobacco to go through the bloodstream and the placenta in the uterus into the fetus, and will complicate the development of that fetus in the womb, okay? And it can't be emphasized enough that carbon monoxide, which is what is inhaled every time you smoke, okay? In the case of a pregnant woman, it goes right into the, through the placenta into the fetus, and the effects of the carbon monoxide intake reduces the amount of oxygen that the fetus gets. Just think about how bad that is. But okay, let's not talk about, oh, this next warning says smoking causes lung cancer, heart disease, emphysema, and may complicate pregnancy. Notice it doesn't say may cause. They used to. Now they say smoking causes these serious end-stage illnesses that smoking causes. Oh, I have a pack of British cigarettes right here, and I look at it and I go, oh, this one says smoking kills. They don't compromise in the UK. Look at that, smoking kills. Well, it sure does. Cigarette smoke causes all of these diseases and many more, okay? So, okay, oh, this one here says quitting smoking now greatly reduces serious risks to your health. Wow, well, it's a compromise because your body immediately starts the process of healing and repair when you stop smoking today, as you will. Oh, your package happens to say cigarette smoke contains carbon monoxide. Ooh, that's what you have. What, you know what carbon monoxide is? You do, okay. You know it comes out of the exhaust pipe of your motor vehicle, right? If you sit in your vehicle in a closed garage, run it, that's not a good idea, is it? Well, you know that if you were to, you wouldn't do this, but if you were to be outside on the street, in the driveway, whatever, and you were to get down behind the exhaust pipe of your motor vehicle while the vehicle is running and inhale the smoke for 10 minutes, you wouldn't do that, of course. You'd get dizzy, you'd probably pass out. But the amount of carbon monoxide that you inhale in 10 minutes does not equate the amount of carbon monoxide you inhale from one cigarette. And if you don't believe me, look it up on your phone. Not now, but when you leave here, okay? It's the truth, it's a fact, it's been proven. Okay, now, so we've done that, and that process of waking state reframing is 15 minutes. So basically, we've used up 25 minutes of a 1 hour session. Okay, 1 hour is what I give. For $350, there's absolutely no insurance accepted for this, no compromise, no discounts, okay? They get 60 minutes. We've used up 25 minutes, okay. Now, what do we do next? What we do next is we do our hypnosis pre-talk, okay? Hypnosis pre-talk. And what do we cover in the hypnosis pre-talk? What we cover is the client's expectations of the hypnosis experience. In other words, what do you think hypnosis is? Have you ever been hypnotized? Okay? Do you have any questions about hypnosis? Okay? Is there anything about hypnosis that you're afraid of? Are you willing to experience hypnosis with me today, here in this hour in my office? Okay? And I'm gonna, once they say yes, I'm gonna say that, look, here's the bottom line. I am going to help you experience hypnosis. And the hypnosis you're gonna experience is gonna be profoundly relaxing. It's gonna be calming. It's gonna be fun. You're gonna have fun. And you're gonna focus. And the part of you that is a naysayer, that's always criticizing, analyzing, thinking something is not gonna work, will be taking a little break while you're in hypnosis. What I'm gonna do is I'm gonna give you suggestions while you're in the trance to imprint in your subconscious mind what your subconscious needs to believe, so that when you leave here, you're gonna have no urge and no desire to buy another pack of cigarettes. You don't have any cigarettes left, right? You've left them with me. So it's gonna take a conscious, deliberate action for you to go to Walgreens or CVS or Wawa or wherever you go to actually purchase a pack. You're not gonna have any desire to do that after these suggestions are imprinted in your subconscious, okay? And of course, by this point, I've spent 15 minutes doing that waking state reframing, and I've gone over the Surgeon General's warnings, and I've also said a few other things. And the main thing, it's on your handout, under reframe the following 3 myths. The myth that's most important to reframe is that smoking is an addiction. It's not, it's a habit. Hey, addictions can't be cured. People recover and are in recovery for the rest of their lives, but habits can be changed. Everybody get that? If you don't get anything else from this workshop, from this lecture, that's the most important thing. Again, smoking ain't an addiction. It's a habit. Addictions do not get cured. You're always recovering. Habits can be eliminated. Get that, and you've got the main idea of this lecture. Myth number 2. You're going to have urges, cravings to have a cigarette. You're not going to have any urges. You're going to have a memory that you used to smoke and you don't want to smoke ever again because you have a good reason not to smoke. You have many good reasons not to smoke. That's the key. You don't have an urge, you have a memory. Urges require action, memories don't, right? Memories. This morning, I went to Denny's, I had an urge to have pancakes. Well, you want to know the truth? I had the pancakes, and then my blood sugar went whoop, way up. I know that that was a mistake. It wasn't a failure. And that is, I didn't have that here. Well, just remember this. This is number 2. Even though I can't find it here, it is actually, okay, if you look on the back of your handout, additional waking state reframing. Those of you that are listening on the internet or on the recording, you have access to the handout on IMDHA's website. Okay, but basically the idea is you can't fail at this, you can only make mistakes. Humans make mistakes. You're not going to fail at this. This morning I went and had pancakes at Denny's. It was a mistake. It wasn't a failure. I took my blood sugar and it went way up. And I realized that if I'm going to have pancakes, it's got to be at home, the high protein stuff with syrup that is very low sugar content. But I made a mistake this morning, and now I know. Okay, you'll make mistakes? Okay, no problem. You know, remember I told you on the telephone, it's $3.50 for one visit, and you can call me when you need to call me, or text me, or email me if you're having, Oh, if you made a mistake, yeah. For 1 month, you make a mistake, you're human, text me and we'll correct your mistake. That's part of what you're paying me for. You get this session and you get unlimited phone calls or texts, preferably texts. We correct your mistakes and you're good to go. If for some reason you need to come back in the office and see me again, we can work that out. And I have tremendously effective techniques to help people beyond this one session if you need it. But you probably won't, because you're here because you want to stop smoking. You want to end up smoking. Okay, so we're up to the I told you the hypnosis pre-talk. You know, you're not going to be a zombie. You're not going to be clucking like a chicken. I can't make you do anything you don't want to do, including stop smoking. Okay? If you don't want to stop smoking, nobody in the world can make you do it. But I can help you stop smoking with the greatest of ease. Remember that? That's key. Write it down. You're a hypnotist now, can help you stop smoking with the greatest of ease. Isn't that nice? With the greatest of ease. Okay. All right, it's time to do hypnosis. Rapid trance induction, 5 minutes. Okay? So what are we up to? Cumulative time, 30 minutes, half the session's used. Now we're going to do hypnosis. We're going to induce hypnosis in 5 minutes or less. All right? 35 minutes gets used up. I'm going to tell you, I'm going to demonstrate, but 35 minutes is used up. Okay, next page. I'm trying to stay on track here. Okay, so now we have 15 minutes to leave them in trance, to give them suggestions. They're called trance state suggestions. And what are we going to tell them in trance? Take notes. Let me take a whistle of water. I always have water available in my office. Now, later, during the question and answer, we're probably going to cover, can you do this virtually? And the answer is, I haven't. I haven't done it on Zoom. But I probably will. Okay. The trance state suggestions essentially are imprinting the most important ideas for that person. It's not a canned program. I'm going to assess what's most important for that person, okay? And I'm essentially reinforcing the waking state reframing, and I'm hitting on what's most important for that person to hear, okay? Imprinting. So I'm going to tell you, if you're my client, that hypnosis, but what we're going to do when you're hypnotized, we're going to fix the suggestions that are most important for you in your subconscious. In your subconscious. So when you leave here, you're going to not have any urge or desire to smoke. Okay? You'll have a memory of smoking, having smoked in the past, and that's okay. You'll realize it's just a memory, and you'll just dismiss it and go on with what you want to do. But in addition to that, I'm going to teach you a way of coping with stress instantly without anybody knowing it. And you'll just blow the stress away. Okay? And you're going to learn that when you're in the hypnosis. Would you like that? Who would like to learn that? Anybody here would like? Raise your hand if you'd like to learn that. Okay, because I can teach it to you. Okay, very good. All right, now, trance state suggestions. Well, basically, why don't I do this? Why don't I do a hypnosis group induction for everybody in the room? I'll hypnotize you all, or should I say facilitate your going into hypnosis in a way that's comfortable for you. Now, if you're not comfortable going into hypnosis, you don't have to participate. You can just listen, okay? Or you can walk out and come back. Somebody can alert you to when the hypnosis is over. But it's a simple little thing. All right, so if you want to be hypnotized, just listen along and expect to go into hypnosis deep enough so that the suggestions I'm going to give you, and I promise you, they're going to fit why you're here. What I'm going to tell you while you're in this calm, focused state of attention will give you everything that you want. And the reasons you're here in this workshop, it will fulfill those reasons. Okay, does that sound good to everybody?
Yes.
Yeah? Okay, cool. All right, so settle down, settle in, get comfortable in the chair, and all you need to do right now is just simply sneeze if you have to, adjust yourself, get comfortable, feel your feet on the floor, Some people like their feet flat on the floor, and some people like to cross their legs. It doesn't really matter, whatever's comfortable for you. And as you listen to the sound of my voice, with every breath that you take, you can become calmer and calmer and more focused. If you need a drink of water, please be free to have a sip of water. And the drinking of the water, the sip, will help you to focus better and relax more, okay? With every breath that you take, so I'd like to invite you to just pay attention to your breath. Just pay attention to your breathing and notice, without trying to control it, that with every breath you take, it becomes easier and easier to settle in. And if you like, you can take a deep breath and then let it out slowly, and just imagine you're blowing any stress away that you want to get rid of. Taking in a deep breath, holding it, and then blowing it out slowly, getting rid of any stress you need to get rid of. And then just letting your mind go back to focusing on your breath. It's really very innocent. It's very similar to meditation. It's very similar to prayer. I like to pray. People close to me like to pray. I like to meditate. I don't know exactly what you like to do to get in touch with your higher self, with your higher power, but what I am here to help you experience is just simply a calm and focused state of attention, so that your mind, your deepest feeling mind, can take in the suggestions you need to hear and really grasp those ideas, so that you don't have to think anymore about making the right choices. You made the right choice of coming to this lecture this morning, and the reward is that you're experiencing a pleasant, calm, focused state of hypnosis, where with every breath you take, you feel more focused, you get more in touch with your feelings, and as you get more focused, you get more comfortable. So the more comfortable you get, the more focused you feel. And the more focused you are, the more comfortable you feel. It's really very natural. It happens all the time. It happens when you're dreaming. It happens when you're falling asleep. It happens when you wake up in the morning. And it happens whenever you make a choice about whether or not you're going to do something for yourself. You are here and you are doing something for yourself. That's very important. You decided to come to see me and pay me good money that you could have used for other things, for me to help you to stop smoking for good, for your own good. So you might as well listen and take in the ideas that will make your trip to me worthwhile for you. Because, you know, and I say this to everyone, for you, but more so for your body, cigarettes are poison. For you, but more so for your body, cigarettes are poison. In fact, for me, but more so for my body, bleached flour is poison. Refined sugar is poison. Nicotine is poison. Cigarette tobacco contains over 7,000 chemicals. None of them are healthy. Over 100 chemicals that cause cancer. The Surgeon General tells you that cigarette smoking causes lung cancer. It causes emphysema. It causes heart disease. And it complicates pregnancy and probably causes the fetus to be malformed. Cigarette smoke contains poison for your body and for you. You need your body to live. That's right. You need your body to live. Nod your head when you know that your body is the most important thing in the world to you. Nod your head when you recognize that. That's right. Your body is the most important thing to you because your body is your place on this earth. It's where your spirit and your soul reside on this planet so you can experience life as an earthling, as a human being. And your body deserves your respect. Your body deserves your protection. Only you can protect your body, no one else. Only you can protect your body, no one else. You wouldn't let a little child, a 3-year-old child, a toddler, cross the highway by himself or herself. Why? Why would you endanger your innocent body by putting poison into your body? It's innocent, just like that little child. It's innocent. Think of that little child whenever you have a memory that you used to smoke. And I promise you, that memory will fade away. It's really not a memory you want to have. You certainly won't have any desire, no urge, no craving to put poison into your body any longer because you know that your body is innocent. And only you can protect that little child. Only you can protect your child, your body, your home on this earth. Only you. Only you. And I want you to know that you came here. Well, you know you came here because you recognize that smoking is costing you a ton of money. You know that smoking is costing you a ton of money. But when we talked earlier, you told me that you were conflicted about that. That you know you like smoking, you know that it gives you a reason to take breaks from work. Well, now I'm gonna help you recognize that, number one, there isn't any conflict anymore. Because even though you came here, you said, to save money, you also gave me $350. Make that money well spent by protecting your body, by taking in what I am sharing with you so that your body will thank you. And you no longer are gonna need to use cigarettes to take a stress break. Cigarettes, you're no longer gonna feel like you used to feel, driven to smoke because your boss gave you a headache, or because your spouse is a pain in the neck, or because your brother makes you burn up. From now on, whenever you have a stressful thought, you can dismiss the thought, and the instant stress release I'm now teaching you is as simple as picking something to look at so no one knows you're doing it. It doesn't matter what it is. It could be your boss's nose. It could be a knob on a drawer. It could be the can of orange juice on your desk. It could be the strawberry on your plate. And as you stare at that point, take a nice slow deep breath in, and I'd like you to do it now. Breathe in deeply, breathe in, and hold that breath. Hold it as best you can, and then let it out slowly all the way down into your stomach. Releasing stress and tension out into the atmosphere, that's right. And you can still keep looking at that strawberry, taking a nice deep breath again, deep, 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 deep. Hold it, feel it pressing against your chest. Let it out slowly, continuing to stare at that strawberry as you release stress and tension out into the atmosphere, and feeling so good that you now have in your pocket, in your chest, in your abdomen, in your brain, an instant stress release technique, which the more you use it, the better you get at using it. The more you use it, the more effective it becomes. The more you use it, the more of a habit it becomes. Isn't this a good habit? Nod your head if you feel this is a good habit. If this is a good habit, nod your head. I want to see you nodding your head if you believe this is a good habit. Of course it's a good habit. And you'll find that you do it more and more and more. Now that you have a better and more satisfying and healthy way of instantly reducing stress, from now on, and you'll remember this, consciously and subconsciously, whenever you see anyone else smoking, because you told me that you were concerned that Myra smokes in the house and you can't stop her. Well, whenever you see Myra lighting up a cigarette, the sight of that cigarette, the sight of her lighting up, the smell of her burning tobacco, watching her smoke will be an instant reminder to you, consciously and subconsciously, that smoking is something that you never want to do again. That you don't want to smoke, you don't need to smoke, you don't care about smoking, and the sight of someone else smoking, the smell of their burning tobacco is a reminder that this is something you don't do anymore. And you feel good about it. And every time you see someone else lighting up, it becomes a way of instantly making your resolve to be a non-smoker stronger. And nod your head when you recognize that seeing that other person lighting up strengthens your commitment to your body. Nod your head when you recognize that seeing someone else poisoning themselves, unfortunately, strengthens your commitment to respect and to protect your body. I'm going to wait until you nod your head. That's right. Excellent. Now, in a moment, I'm going to ask you to alert yourself. Remember, I told you that all hypnosis is self-hypnosis. You're simply allowing yourself to get focused and calm and allowing me to help you to do it. I didn't make you hypnotize yourself. I didn't hypnotize you. You just simply you have let me lead you into a calm and focused state, and I thank you for that, because I want to make sure that you get your money's worth. So thank you for doing this with me and cooperating. Now in a moment, but not yet, I'd like you to slowly bring yourself up to an alert state, and when you're alert, you'll open your eyes, but you will not open your eyes until you believe on the deepest level, until you feel deeply that you got it, that when you leave here, you will have no desire, you'll have a memory that you were a smoker, you'll have a memory that you wondered when you left here, will you want to buy cigarettes again? But you won't have a craving, you won't have an urge, and you'll feel it and you know it. And when you know on the deepest level that it's only a memory and not a craving, you'll open your eyes and be wide awake and alert and refreshed, and we'll just simply discuss what you got from this session. Hey, that was nice. So nice. Oh yeah, stretch, round. That's right. That was pleasant, wasn't it? That was really good, right? Of course it was. It's natural, it's easy. And it's always nice to have somebody help you to achieve this natural state that you and I and all human beings experience every day, called spontaneous hypnosis. And we did it here, and now, someone please volunteer. Let me pick someone. Raise your hand if you're willing to answer a couple questions for me. Somebody. Raise your hand, volunteer. Yes, ma'am. What is your name, first name?
Mary Beth.
Mary Beth. Listen, I appreciate your having come today for this lecture. And my question to you is, how do you feel right now?
Extremely relaxed.
Oh, that's so good. Did you enjoy the experience of the hypnosis?
Yes.
Great.
Very much.
Do you recognize that while you were relaxed and calm, that you were focused?
Very focused.
And that the suggestions that I had given you that are on your handout, that I had told you about, and things I taught before you went into this special, calm, focused state, I reinforced them and fixed them into your subconscious mind, and I did that for everybody else here. Do you recognize
Yes.
that? And I'm going to tell you something. There are a couple of ideas that you now know, and you know it very, very deeply, and you don't have to worry whether or not you got it, because you got it. But if I were to ask you, which I'm going to do right now, what's the most important thing that you learned in this lecture? I know you can have an answer for me, and whatever your answer is, I'm eager to hear it. What is it?
That I need to take care of this 3-year-old body
Mhm.
child.
Yes,
Protect it.
that's right. It's your job, it's your responsibility to protect that body, that child. That's right. Anybody else want to volunteer what they learned? What did you learn during this lecture? Anybody? Raise your hand, please, help me out. Yeah, thank you. What's your name?
Renee.
Hi, Renee. Thank you for being here. What did you learn, and what do you feel on a deep level, without looking at your notes, which I appreciate that you took?
That my body is innocent, and it is my responsibility not to poison it on a
Right.
daily basis with, and now you were talking about smoking,
Mhm.
but you also said that white flour and sugar were poisons as well.
That's right.
So I kind of incorporated that.
That's right, that's right. And you know, for everybody out there listening in from the electronic highway, I want you to know that you can ask yourself the same question that I just asked the people that are here now live in my class. And answer that question for yourself. And every time you do that, you're going to reinforce your own motivations for making a healthy choice. Now, for further information, if you really would like to learn how to do this as a hypnotherapist and really get the kind of success that I get, which is at least 70% in one session of people stop smoking and don't smoke for over a year after I see them. And then those that can't do it on their own and make mistakes repeatedly during the month during which they can be free to call me or text me to help them, they come back for another session. And it's during the second session that I get into what you might call hypnoanalysis. However, how much time do I have left? 5 minutes, enough time for me to simply say it like this. Raise your hand if, and I know Robert Otto is here, and Jillian Lavelle is our monitor, and you guys have heard of Cheek and Lacrone, right?
Right.
And you guys have heard of their 7 keys. The 7 keys of David Cheek and Lacrone, where they talk about conflict and organ language and motivation and secondary gain. Well, in the second session, I do a rapid hypnoanalysis. And I essentially key into what are the key motivators for their mistake. It could be conflict, and it spells, oh, let me write this down here. Oh yeah, this is what I need to do, so you can see it. And for those of you that are listening, well, guess what? I'm going to spell it out for you. It spells compass. C-O-M-P-I-S-S, okay? I instead of A. All right, so what does C stand for? Conflict between urges, between thoughts of what you need, what you want, what you shouldn't do. O, organ language, where you basically talk about how stuff, experiences of stress affects you and your body, giving you a headache, making it hard for you to breathe, giving you a sour stomach, you don't want to swallow it anymore, stuff of that nature. Okay, M stands for motivation. Hey, you all get secondary gains from doing stuff you know ain't so good for you to do. Secondary gains like for a smoker going out and taking a break from work, okay? Now, what's P? P stands for past experiences. So how many people remember a time when you smoked and loved it and you thought you looked good, it made you feel good, it made you look cool, whatever it is? Well, guess what? We're gonna erase that from your subconscious, past experiences, okay? You'll be able to keep the good parts of the memories, I promise. But the smoking part will be taken out. Is that all right with you? You wanna do that? Okay, cool. I stands for identification. Did your dad smoke? Did you smoke with your dad? Did you smoke with your brother? Oh, your brother died of lung cancer. I'm really sorry. That's tragic. You smoked together, didn't you? Well, guess what? You're not your brother. You're not your dad. You can keep the good parts of the memory. You don't have to remember smoking. You don't have to smoke now. in order to remember all the good experiences you guys had. Oh, there's 2 more letters in COMPASS. We have self-suggestion. That's S number 1. And you know what a self-suggestion is? I'll tell you. It's something that somebody in authority had told you and you accepted it uncritically because your dad used to say, you're never going to be able to stop smoking. If you start, you're never going to be able to stop. Well, prove to yourself and to your dad as you remember him that you stopped. It's not true. It's just a suggestion and we're erasing it from your subconscious. But the last S is the most important of all. And you know what, folks? This is the one that you gotta expect to pop up in the 30% of people that don't stop smoking from that one session who you need to see again. And you know what that last S is? It's called self-punishment. Self-punishment. It's the lady with oxygen in her nose, in a wheelchair, that can't talk, that coughs, that's hoarse, that can't breathe, that's emphysema, that had a stroke, that's in the rehab center, and she is smoking cigarettes. And why is she doing it? Because she hates herself. Because she's angry at herself. Because she recognizes that there ain't no more point in doing anything healthy for herself because she feels like she doesn't deserve it. And you know what? She deserves to enjoy the rest of her life. And she deserves to treat her precious body with respect and dignity. And so do you. And so do you. You no longer need to keep punishing yourself by putting poison into that precious 3-year-old body. And with that, I now end this lecture, and I'm open to questions. Thank you for being here. Thank you for listening. Thank you for attending. 1 minute left. So, questions, raise your hand and I'll answer them in as fast a manner as I can, which is always hard for me. Yes?
What do you charge if they have to come back for that second?
Oh, I charge $250 an hour and
Okay.
$350 for that one visit. That initial visit is $350. My typical charge for an initial visit is $350 anyway, and $250 an hour. But there's no insurance for this. In these cases, sometimes I will, well, I don't, because once I don't, you know, this is outside of insurance. Okay.
Thank
Yeah. You're welcome. Any other questions?
So
Yes,
if they,
Sean.
so if they do the follow-on session with you, it's another $250 for that,
Yes, yes.
okay? And how do you, all right, well, that actually answers my second question. Good. thank
How
you.
do I what?
No, I was thinking about something, a follow-on, but no, you answered both my questions
Yeah,
with that.
but I gotta tell you, when it comes to the second follow-up session, I am willing to be adjusting my fee to help somebody. It's like the first session, the stop smoking session, there's no adjustment. But if you come back to me because you recognize there's issues you need to work on to make it happen, and you can't afford $250, you know, I'll adjust the fee to what you can afford. I see people where I, believe it or not, take $80 for a 50-minute session. It's all right, you know. I want to help people. I get great satisfaction out of it. So it's not about the money at that point. All right? Anybody else? Any more questions? We got 15 more seconds or something like that. I want to thank Jillian Lavelle for monitoring us, monitoring me, keeping me on schedule. Jillian is an amazing lady who has really been the originator of IACT, I guess. IACT, or IMDHA.
Yeah.
Which one?
I'm the OG.
IACT, okay.
Original gangster.
Yes,
I mean-
thank you. So anyway.
Be sure to go ahead and fill out your feedback forms. We really appreciate that.
Thank you.
Let them know how
Please
wonderful
feel
it was.
free to, I do a full workshop, a one-day workshop on this, and you can sign up with your interest, put your interest. In other words, join my email list on bruceheimer.com and register your interest. Okay, thanks for being here.
Thank you.
You're welcome. You're welcome.